Good afternoon. I'm Dr. Radhika Krishnan. My AIS number is 15839, and I'm going to talk about the existing ignorance about diabetes and diabetic retinopathy. We all know India is home to about 73 million people living with diabetes, of whom 58.4% are unaware that they have diabetes. In addition to this, an additional 10.3% of our population aged 20 plus is known to be in the pre-diabetic state, 60 million with pre-diabetes. That is a huge burden. An AIS study, the READS paper, estimates the prevalence of diabetic retinopathy in known diabetics to be about 21.7% across the nation. And this is bound to increase with the number of diabetics being detected. Our own project, the Adityajot Diabetic Retinopathy Urban Mumbai Slum Study, DRUMS, is an ongoing population-based cross-sectional study conducted in the slums of Mumbai. Our model is an epidemiological survey where there is a door-to-door approach. The health workers are doing an awareness and a screening for diabetes, followed by a diabetic retinopathy screening, which is done in the van, and referrals happen for further treatment. As a part of this study, we included a questionnaire on the knowledge levels of diabetic retinopathy among diabetic patients and the major hurdles they have in seeking eye care. 1,373 eligible subjects were enrolled in the study, and they were asked two questions. How did you come to know that diabetes can affect the eye? Second, being a diabetic, why did you not go for an eye examination? The results, we found that the causes for the diabetic patients, even after being detected diabetic, not going for an eye exam, lack of awareness, about 49.2%, financial constraints, 22.5%, busy schedule or other reasons, 15.5%, and a 12.8% of people thought that it was a sheer waste of time. So the major cause that we found of not seeking eye care was found to be the lack of awareness, which was noticed in more than half of the study population. Out of all the methods of awareness that were available to them, we found that the majority of them, about 73.49%, found out about the complications of diabetes either through the state-run ASHA health workers or our own community health workers. In addition, the other sources which we looked at were physicians, opticians, ophthalmologists, optometrists. All of them put together contributed at 26.51%, and this is in a city of Mumbai. India has a lack of access to early screening for a variety of chronic eye diseases, resulting in an increase in expense on tertiary eye care, increasing prevalence of preventable blindness, and inefficient utilization of our healthcare resource. There is also a huge shortage of trained ophthalmologists, especially in the rural areas. I would like to focus attention on the National Health Mission, where the ASHA or the accredited social health activists have been used to strengthen the decentralized village and district level health planning and management. One of the core strategies of the NRHM was to promote access to improved health care at the household level through the ASHA. This has worked by providing every village in India with trained female community health activist volunteer. I stress on the female because they form an appeal to the integral households, to the women in the households, and they are able to bring about changes in determinants of health like nutrition, sanitation, and hygiene. The role of ASHA, they have over the years, it has been seen, they have mobilized the community towards local health planning that increased utilization of primary health care and thus place the health of the people in their own hands. They play a potential role in providing primary health care at the village level. So we would like to suggest that since the most effective mode of patient awareness that we found was either through the state-run ASHA or through our own community health workers, we propose that a similar model for better reach of eye care programs should be adopted in the community as a whole. To conclude, we found that the major cause of diabetic patients in the slum population not seeking eye care was lack of awareness, with financial constraint being only the second highest cause. The most effective mode of patient education was found to be through our community health workers, and therefore we suggest that we need to focus our attention to train and incorporate diabetes screening in the NHM through the ASHA workers to reduce the cause of vision loss due to diabetes. These are my references. Thank you.